Medical researchers in Hong Kong say they have identified the world's first case of a person being infected with COVID-19 twice. So this raises the prospect that even with a vaccine, this particular coronavirus may never disappear completely. Reporter Richard Kimber is on the story for us. He's live from Hong Kong. Let's go through the details of this, Richard. Not the first reports of this, but the first confirmed case of a reinfection. Tell us more.
Well, the first thing to understand is that this effectively came by chance. It involves a local IT worker, a 33-year-old man who tested positive back in March for the virus, was admitted to hospital, later released in April, but then only in the last few weeks after taking a trip to Spain and returning to Hong Kong did he find not only was he carrying the virus again, but a different strain of the virus. And because of the compulsory testing on arrival at the airport, he effectively became the first known confirmed case of a reinfection.
So now that we know this, and I know that researchers have identified, traced the virus, sequenced the virus, they know it's two separate cases of infection. How is this likely to change things and influence the local health response?
Well, as you can see, I'm still wearing a mask. That's still very much the rule here in Hong Kong. But actually, just a few hours ago, the government has announced here that it's going to be relaxing some of its strict social distancing regulations because of successive weeks of declining numbers of cases here and pressure from economic and public figures trying to get the city back to normal. So on a local level, things are actually opening up again here. On a global level, I had the chance earlier to talk to one of Hong Kong University's top microbiologists who's been investigating this reinfection case. Let's listen to what he had to say about the future of the coronavirus globally.
I think it's past the point of no return, and we have to acknowledge that this virus is going to continue circulating in human populations for some time to come. Now, this reinfection case provides us with a kind of preview of things to come, that people who have actually caught COVID-19 before, we're talking about millions of people around the world, are probably at some risk of reinfection.
So he's saying there, the downside is, of course, now there'll be hundreds of thousands of people who have already had the virus who may end up finding that they're going to get it again without necessarily even realizing. But on the flip side, he says one positive from all of this is that the fact that this new reinfected case showed no signs of the virus, was asymptomatic. It does demonstrate the natural immune response to the first infection and suggests that in all cases of reinfection, the symptoms may be much milder and therefore far less health impact than perhaps the first time around. So some level of positivity regarding the immune response, even if it causes much bigger problems for the government management of the virus going forward.
Much global interest in this story. Richard Kimber in Hong Kong, thank you very much for it.